Democratic Senator Elizabeth Warren, who is running for president as well, has released a plan for how to pay for Medicare for all. And we're going to go through it and we're going to break it down. But we do need some important context in order to do this correctly. One controversy around Elizabeth Warren and Medicare for all is that there's a criticism of her that she's not really for Medicare for all at all, but that maybe she's open to it along with lots of other ideas, which are actually the ones that she would pursue. And if that's true, then that is absolutely a concern. Now, lately, I'm seeing her talk more and more about how Medicare for all is the way, being more and more for it, even in supposedly leaked behind the scenes private video talking to union leaders. She still was talking about how Medicare for all, she believes, is the way to get the most care to the most people, the most cheap, in the most affordable way possible. So that's number one. And certainly putting out a plan for how to pay for it is a good sign that she's taking it seriously. Second piece of context, there are questions specifically around the cost of Medicare for all that I've brought up. Medicare for all can still be the best plan. I still support Medicare for all. But at the same time, if there are unanswered questions, if there are real criticisms of it, not dumb ones like the U.S. has a lot of people, so it wouldn't work. That's a dumb criticism. We've already talked about that. There are real criticisms. And on the left, we want to be prepared to address and deal with those. Now, I know that there are people on the left who will say, but David, nothing on the right ever has to be perfect, and they do it anyway. So why does everything we do have to be perfect? It doesn't have to be perfect. And in fact, it's not, and it may still be the best thing and the path most worth pursuing. But we should not pretend that these questions don't exist because we want to be equipped to answer them. So to remind you, the problems with most of the prior plans for how to pay for Medicare for all are mostly twofold. Problem one is that many of the plans that say, here's how much it'll cost and how we pay for it, they are assuming a drastic reduction in healthcare costs in the US to the levels of Australia and Canada, which are about half of ours, in order to make the numbers work. But they don't say how they would do that. They say we will do it, but they don't say how. And the reality is that the health insurance bureaucracy that we have does add cost to the system. So if you get rid of that with a Medicare for all system, you do shave some of the cost, but only a little bit of what you would need to shave in order to cut the price of our healthcare delivery by 50%, which is what Australia and Canada have. If you can't explain how to do that, the numbers don't work. That's a problem with a lot of the plans that are out there. Number two, the other issue is that a lot of the plans for Medicare for all include these phrases that nobody in the middle class is going to pay more in the net, but we've not seen the middle class defined, and you can get pretty slippery with that. And then lastly, there's also the question of, would Elizabeth Warren or anyone else's plan make private insurance illegal as an industry, or would it simply say, let whatever happens to private insurance happen? If people want it, okay, it'll probably go up in cost as people get out of it. And that's it. And I tend to favor that. I think that it's legally difficult to say this industry can no longer exist anymore. So I think as they like to say, the free market solution should be applied. If hundreds of millions of people get out of private insurance, I think the problem will sort of solve itself. Okay, so let's look at Elizabeth Warren's plan for how to pay for Medicare for all. Now, as we look at this list, understand that lots of this is controversial, and I'm not going to hide that from you. First of all, Warren estimates the cost at $20.5 trillion in additional spending by the federal government over 10 years. This is much lower than what the Urban Institute analysis says. They have a very detailed projection which says it'll cost $34 trillion additional over 10 years. That alone, like if that's true, if the cost is really 34 instead of 20 and a half, that already makes Warren's math completely wrong. Now, there's already some confusion about these numbers. On the one hand, she says it'll cost $20.5 trillion. But on the other hand, she says on her website that it's a $52 trillion over 10-year plan. Which is it? It's sort of both, and this is confusing, and it relates to the fact that some of the existing costs paid by consumers would instead stay in the pockets of consumers, but then there will be new spending that has to make up for that, which is what they call additional federal spending. But the idea is, either way, the baseline is $52 trillion over 10 years. In one case, the government is in the middle, and that's what needs to be additionally funded. Now, if you look at the savings that Elizabeth Warren lists, or where she would pay for where the money would come from to pay for this additional spending, she says 8.8 trillion comes from employers. Instead of paying health insurance premiums to private insurers, they start paying the government through a payroll tax. That's 8.8 trillion. 2 trillion comes from taxing the investment gains of the top 1%. 1 trillion comes from a wealth tax on billionaires. 800 billion comes from taxes on financial transactions, and then 6.1 trillion is contributed by the states. That adds up. And then she also, is assuming drastically lower costs, which we're going to talk about in a moment. These numbers add up if you believe the additional spending is 20.5 trillion instead of the 34 trillion, which the Urban Institute says it will. And that gets us to the assumptions about lower prescription drug prices and reducing administrative spending, but more importantly, reducing what we pay for healthcare, period. And this is where her plan falls short. This is not unique to Elizabeth Warren. She assumes that healthcare costs will, number one, drop to be much closer to those of other countries, and number two, grow much more slowly than anticipated. You have to defend those assumptions because they are huge, complicated things. And as yet, she doesn't appropriately defend them in her plan. This is not me being a Warren attacker nor a Warren shill. This is me just looking at the data and the criticisms. If you look at Elizabeth Warren's plan on her website, it is assumed as a foregone conclusion that healthcare spending drops drastically and rapidly and almost immediately when you switch to Medicare for All. I already told you in my general analysis of how to pay for Medicare for All that serious experts, even experts on the left, say that these expectations are unrealistic. There are estimates that in the best of cases, it could take decades to tamp down healthcare costs in the U.S. to make 20.5 trillion a realistic number. A more realistic number is 34 trillion, as cited by the Urban Institute. So to be completely frank, this is a fine plan. It's not drastically different than most of the other plans that we've seen. And it's a problem is it counts on drastic reductions in healthcare spending that cannot be assumed unless you explain why is the Urban Institute and other economists that have looked at this, why are they wrong? And why is Elizabeth Warren right? Or why is Bernie right about the drastic reductions in spending? Because you can't attribute it simply to changing systems. Simply going from a private insurance system to Medicare for All doesn't drop healthcare spending by the 50% it would need to drop to match that of Australia or Canada. All this being said, Medicare for All may still be the best plan, even at 34 trillion in additional spending over 10 years. But we've got to figure out how to pay for that. It's doable, but we just have to be honest about the numbers. And this is now the trend, that the proposals that are being put forward for how to pay for it have extraordinarily optimistic numbers about the cost, which serious think tanks and economists simply don't agree with. That being said, Warren being more and more behind Medicare for All, that's good, but we've got to resolve this issue because otherwise it either will not happen, even with a Democratic president, or it'll happen and we will be shocked at how much more it will cost, which is also a problem. If we're going to do it, let's do it right based on what it'll actually cost. We've got to deal with it at some point in time, and I hope it gets dealt with soon.